Doctors call for dementia action. More than 3/4 of GPs think their patients with dementia rely on family as they don't get enough help from health and social care services. Almost as many, 73%, believe their patients are forced to depend on friends, neighbours and other unpaid carers for support. These stats are among the results of a survey of over 1,000 doctors about levels of care for people with dementia. The poll finds that half of GPs think the NHS is doing too little to care for people with the condition. More than 2/3 believe patients don't get enough provision from adult social services after a diagnosis. The Alzheimer's Society is warning that too many people with dementia are being let down by a system which fails to meet their needs. 7 in 10 GPs say people with dementia are left unsupported because of a shortfall in accessible local services. A further 61% say lack of cooperation between the NHS and social care acts as a barrier to patients getting support. The survey suggests patients' lack of access to services may be undermining a national drive to improve rates of dementia diagnosis. Some 27% of GPs admitted they would be less likely to refer people with suspected dementia for diagnosis if support services are not in place. Other key findings include fewer than 1 in 10 GPs say people with dementia get enough statutory support to deal with loneliness and maintain a good diet. Only 27% of doctors believe the NHS and social services give people with dementia enough support to tackle anxiety and depression. 73% believe patients, families and carers are left confused by the health and social care system. Nearly 1/4 of GPs said they lacked sufficient training to give them a good understanding of how to manage a person with dementia. Jeremy Hughes, Chief Executive of the Alzheimer's Society, said, "Our survey gives a stark view from the doctor's surgery of people with dementia left struggling in the aftermath of a diagnosis. GPs report an endemic and deeply worrying lack of support available from health and social services, with relatives left to pick up the pieces alone. People can need a lot of help to live well with dementia. Families and friends are a vital source of support, but they mustn't be relied on to do everything. As dementia takes hold, people with dementia and their carers look to statutory services to give them the backup they desperately need to cope. With the number of people with dementia expected to grow to 1 million by 2021, there is no time to waste. The Society is pressing for a national action plan to combat dementia over the next 5 years. The report urges the government and agencies to aim higher to transform the lives of people with dementia. It warns that a gathering momentum of change will be lost unless statutory and voluntary sectors agencies redouble their efforts to improve dementia care. Key recommendations include NHS England and local authorities ensure everyone diagnosed with dementia gets a full package of support, including a dementia advisor. A single point of contact to help carers navigate the health and care system. All hospitals, care homes and home care to be dementia friendly. Source: Alzheimer's Society website.